welcome back in. Well, Dr. Kathleen McKeon is with us today. She is from Andrews Sports Medicine and Orthopedic Center. Hi, thanks for coming in. Welcome in for the first time.
Thank you for having me.
So you are a hand surgeon.
Yes.
And so you were talking about, talking during the break that our hands really are so important, obviously, to us, and that's what fascinates you about hands, right?
They are. People use them for work, they use them for play, they use them to take care of their families at home. So really anything you can do to restore someone's hands back to functional use really affects every aspect of their life.
So they're very grateful, and you like that.
It's very rewarding.
We have a caller. We have Eloise in Birmingham. Eloise, you there?
Yes.
Hey, what's your question?
I want to know why I keep having numbness in my left side and running to my hands.
That's a great question. It's a very common complaint, numbness in the hands. Nerves to your hands, they come out of your spinal cord in your neck and they run all the way down your arm to your fingertips. Those nerves can be compressed at any point along that course. So you can have compression in your neck that can cause numbness in your fingertips. You can have compression at your shoulder. You can have compression at your elbow. And compression at the wrist is very common. We call that carpal tunnel syndrome. So it's important for you to see a physician who can examine you and determine the point of that compression, because obviously wherever the compression is happening affects what treatment you need.
And some could be, are they pretty simple in some variations, or?
It varies. So often for carpal tunnel syndrome, we'll use splints and things like that at night. Those can be very helpful. Sometimes people use injections, depending again on where the level is. So not always surgery? Not always surgery, that's right. Sometimes you do need surgery, but usually we try those non-operative things first.
So what do you recommend for Eloise then?
Eloise, you should probably seek care from an orthopedic surgeon or a non-operative sports medicine physician who can examine you, really examine your nerves, examine your nerve function.
They can kind of trace it to where it's coming from?
Often you can, depending on the physical exam findings, yes.
All right. Eloise, good luck, honey. Let's go to Mary in McCalla. Hey, Mary.
Yes, hey.
Hey, what's your question?
About 6 months ago, my right hand started doing a little shaking, and it's gotten to be a little bit more, and it's interfering with my writing, which I'm right-handed. So is there any idea what I started having, or do I need to see something?
And you haven't had it checked out yet?
No.
Okay.
Shaking in the hands is often caused by the central nervous system. So I said peripheral nerves come out of your spinal cord and run all the way down your arm. Those aren't usually the cause of shaking. Shaking usually is from the brain or higher up, and the people who take care of that are the neurologists. So I would recommend you go see a neurologist who can kind of examine the shaking. They may do some other testing to determine what that's from. Okay.
So Mary, make sure you can make you an appointment with a neurologist and have that looked at. And we also have Mary in Bessemer. Mary, you there?
Yes, I am.
Hey, go ahead.
Okay, sometime in my elbow I get a tingling sensation, and it goes all the way down to my hand, and my hand gets kind of numb, and I'm trying to figure out what could be causing this.
Tingling that goes from the elbow to the hand is often what we call cubital tunnel syndrome. It's similar to carpal tunnel syndrome, only it's in the elbow instead of the wrist, and it's the ulnar nerve instead of the median nerve that's being affected. Again, like we said earlier, there's a lot of things we can do short of surgery for that. There's some braces, particularly at night, and some other techniques to avoid putting a lot of pressure on your elbow that can help. Sitting with your elbow bent for long periods of time is bad for that. So trying to keep your elbows straight, particularly when you're sitting at a desk or sleeping at night, can be helpful.
Does that help you out, Mary?
Yes, it does. Do you think I need to see a doctor for this, or just do some of the things you just said?
If it continues on for more than a couple weeks, if you're having any weakness in your hands, or if you're having numbness that never goes away, you should see somebody sooner rather than later.
All right, Mary, good luck with that. Hey, Charlotte, stay on the line if you're still there, and we'll have the doctor come talk to you off air. We're out of time for now, but Dr. McKeon, thank you very much.
Thank you.
All right, back in a moment.